My name is Benjamin Gielda, and I'm a staff radiation oncologist here at Lakeland Regional Medical Center. I'm very pleased and excited to share with you some new developments in our department, and as well as multidisciplinary collaboration across multiple departments in the treatment of localized breast cancer. Lakeland has acquired something called the Intrabeam device, which is a new means of delivering breast radiation during an operative procedure. The Intrabeam device allows the delivery of an entire course of radiation in one single session in the operating room when a woman is having her breast cancer removed. This contrasts rather sharply with the traditional way of performing breast preservation, which is to perform a surgery in the OR, allow several weeks for recovery, and then either then or after chemotherapy, the woman would then undergo 3 to 7 weeks of daily radiation treatment in our department. This can do away with some or all of that, which results in a tremendous cost savings, a tremendous savings in time, convenience, and it's really hard to be more accurate than delivering the dose of radiation into the cavity that you just made when you took the tumor out. Dr. Jeffers and Dr. Clancy, as well as one of our physicists, David Seifert, went over to Germany to receive specialized training with the device and to learn the technique of placement and so forth. I have reasonable expertise in this already, and I will soon be proctored by other radiation oncologists in the general region that have quite a bit of experience with this device. We're moving forward with treating our first patient, and we hope to have the program up and running by the end of this month. We are leading the way in the region. This will be the second one of these devices in the state of Michigan. Beaumont has the first, but there really is nobody else in our immediate vicinity who has this technology or who is on the cusp of rolling it out. So it's pretty exciting, but at the same time, we're not so far ahead of the curve that we're on the bleeding edge. There is quite a bit of science that underlies the use of this device, and we have every expectation that we'll be able to achieve excellent outcomes while greatly improving the patient experience for the majority of our patients. It is a burden for women who undergo breast radiation to have to come to our department every day. It takes a lot of time, takes effort. Many patients have issues with transportation. They can't work. It goes on and on and on. So it's a major barrier to the appropriate delivery of breast preservation management. Many women, I don't know if suffering is quite the right word, but they have a difficult time with all of these issues. And some women just skip it, which is terrible because we know that the delivery of radiation after lumpectomy is associated with an improvement in survival. It needs to happen. So this treatment, by doing all of it, or some of it, in the operating room, it circumvents all of that. The woman essentially completes her local management while she's asleep, all in one procedure. It's great. And the cost savings are really exciting too. I mean, a single treatment in the OR is dramatically cheaper than a 6 or 7 week course of radiation. So not only are we achieving excellent cancer outcomes, but we're being societally responsible as well.